Tell us about yourself. Briefly describe your professional interests and experiences.
Hello, my name is Jairo. What I could say about my experiences as far as the healthcare setting goes is that I started off as a volunteer at Children's Medical Center, and I did that for about a year to a year and a half. My role there was to assist the kids in the playroom and provide them entertainment and I guess give them some sense of distraction from their medical treatment that they were enduring in the hospital. From there, I applied for a job as a concierge at Children's Medical Center, which my role was to assist families, check them in, and direct them to where they needed to go, and provide them any assistance like getting them in contact with doctors, nurses, or whoever they needed to get in contact with. That was actually also my job, and I also provided like wheelchairs and stuff for patients that couldn't walk. Um, as far as my clinical experiences, I would like to add that I also got the chance to do clinical experiences at Children's for about a month and a half, and I actually got to see a different side to the patients and families as far as the way I interacted with them as a nursing student, which kind of led me to want to keep pursuing my nursing and to be a pediatric nurse someday. And that's where my goals are, and my interest is to be a pediatric nurse and to better my skills and my therapeutic communication with the patients and families.
Where do you see yourself in your career in 5 to 10 years? What are your long term career goals?
Where I see myself in my career in 5 to 10 years is have already gotten the experience necessary as a nurse with my bachelor's degree to in order to go back to school and get my master's, even my doctorate to become a CRNA. I want to become a CRNA because of my experiences as a patient and going through the surgery. So I want to know how to assist the patients and maintain sterile procedure at its maximum and to deliver safe patient care. And I also want to better understand of the process of how anesthesia works, and I feel like as a CRNA I would get the exposure necessary to complete that goal.
What previous job was the most satisfying and why?
The previous job that I would say is the most satisfying is my job as a concierge at Children's Medical Center because it gave me a different exposure to what families and patients go through, especially initially when entering the hospital. So I kind of get to see the way that they feel before they even go to get a procedure done, to go to their clinical visits. So it's kind of satisfying that even if I play a small role in that, I could kind of give them the first impression of where they're going and how things will turn out and how they feel coming in. And also, as they're coming out, as we're saying goodbye to the families and patients there. And I feel like it's also satisfying to me to be able to talk to families even in Spanish because I'm bilingual, and that the satisfaction that they get when they see somebody that's on the same page as them and understands them, it gives them a sense of satisfaction and how their day is going to go, knowing that there's people in the hospital setting that also are bilingual and speak Spanish.
Talk to us about the value of teamwork. What do you do in your last job, internship, or school to contribute towards teamwork in an environment?
The value of teamwork is very essential, especially in the healthcare setting. Whether it's having teamwork with doctors, other nurses, techs, we all have a similar goal in delivering patient care efficiently. And I believe that I've had my experiences with teamwork so many times, especially in the clinical setting as a nursing student, where I had to work with my preceptor or doctors in order to assist the patient in whatever we can and whatever we needed to. So my teamwork experiences have really developed lots of growth during the past 2 years, I would say, even as my role as a concierge in the hospital at Children's Medical Center, whenever one of us is struggling with something in the hospital, or with the patient coming into the hospital, we assist each other if one of us doesn't know the correct answer. But we're open to not making a mistake and believing that we know everything, whether in my nursing role or in my concierge role. We just are open to that fact and are able to ask for help when needed. And that's what I believe in the value of teamwork really is.
Please describe a situation that required you to complete a number of things at the same time. How do you decide what was the most important? Or was the result?
A situation where I would connect to time management and prioritization is a time when I was a clinical nursing student doing my clinical rotations, and I was in the ER, and I got to experience a day where it was a bit busy. We had patients that needed vital signs taken. We had a patient that was having a breathing issue. We also had a patient that was having a circulation issue because they weren't getting a good cap refill on their lower legs bilaterally. So the way I prioritized in that was using the ABCs known in nursing: airway, breathing, and circulation. Obviously, my first prioritization was to go to the patient that was having breathing difficulties and assist them whatever I can as a nursing student. After that, I went in towards the patient that was having circulation issues, where was having a prolonged cap refill on both of their legs. And after that, I went to go gather vital signs. I did all of that just knowing my ABCs with nursing and knowing who to go to first and who needed assistance.